An IVF cycle is done with a lot of hope and expectation and optimism because patients know that this gives them the best chance of getting pregnant. And of course, it's extremely expensive. It's not something which patients can afford very easily, which is why every patient hopes that your first cycle is going to be your last as far as that baby concerned. And we hope so too. We want all our patients to get pregnant because if patients get pregnant, they send even more patients. But the reality is that not all IVF cycles are successful. In fact, the majority of IVF cycles on an individual cycle basis will still fail because most embryos will not implant and most embryos won't become babies because human reproduction is not efficient. Just like every fertile couple doesn't get pregnant every month, they have sex in the bedroom. And the reason they don't get pregnant every month, they have sex in the bedroom is even though they have good eggs and good sperms and they meet and the embryo fertilizes and forms an embryo in the fallopian tube, when it reaches the uterus, it doesn't implant. And the reason it doesn't implant is because most embryos have genetic problems. As a result of which, this is nature's defense mechanism. Rather than give birth to an abnormal baby, you stop the pregnancy there. Now, when this happens in the bedroom, most patients aren't even aware of it. When it happens in an IVF lab, that hurts. But remember, IVF doesn't reduce the chance of your making a genetically embryo which is genetically abnormal. You just need to accept this fact. You need to come to terms with it. But it's equally important to remember that IVF failure could be preventable or not preventable. Now, if you put a top quality blastocyst and it fails to implant, you can't control that. But if you put a poor quality embryo because you went to a poor quality IVF clinic, that is preventable. And that's something you need to prevent by being well informed and finding a good clinic which transfers only top quality blastocysts.